Good afternoon, students. This is my first YouTube lecture. I hope all are enjoying at home, apart from studying. We have uploaded some few lectures on the YouTube, and I request you all to see the lecture and send the feedback. Today, I, Dr. Mrs. Vaishali Ajay Bhagat, Associate Professor, Department of Anatomy from Bharati Vidhyapeeth Deemed University, Homeopathic Medical College and Hospital, Pune 43, is explaining you the topic of Circle of Willis. The topic Circle of Willis has objectives as follows. At the end of the lecture, students should be able to list the cerebral arteries and describe its origin, distribution, and branches. You have to know the Circle of Willis in detail and its applied anatomy. So we go and watch this diagram carefully. You can see the brain with its sulci and gyri in the cranial cavity, and the brain which has arterial system and it. The arteries, the red markings which goes to the frontal lobe, the anterior cerebral arteries, the arteries which goes to the middle forms the middle cerebral arteries, and the arteries which goes to the posterior aspect forms the posterior cerebral arteries. Now these arteries within the brain forms our circle of Willis, which is our today's topic. Let us review the brain before we start with knowing what is circle of Willis. So this large mass of tissue, nervous tissue, which is located in the cranial cavity, has four major regions. The cerebrum, the diencephalon, which consists of thalamus, hypothalamus, subthalamus, and epithalamus, cerebellum, and the brainstem, which consists of midbrain, pons, and medulla oblongata. As you know, brain has two hemispheres, and the surfaces of brain has its own elevations, which are called as gyri, and depressions, which are called as sulci. Each hemisphere divides into four lobes by deeper grooves. Each lobes are separated by the deeper grooves, which are called as fissures. For example, you can see this figure and see the central sulcus, which is a deep sulci, which is a deep depression, and the gyrus, which forms an elevation, and a deep fissure, which will separate the lobes. So we enter into the cerebral circulation. So what is it? So all the blood vessels and the movement of blood entering into the network, which will carry oxygenated blood and the nutrients to the brain, is called as cerebral circulation. Of course, one should not forget the veins, which carry deoxygenated blood back to the heart, removing carbon dioxide and other metabolic products. So overall, the movement of blood in the cerebral circulation is called as cerebral blood flow. Now let us see the arterial supply of the cerebrum in detail. It divides into two branches, the anterior and the posterior cerebral communications. Now here students, please keep this in mind that these two are interconnected by bilateral posterior communicating arteries. Now, what is circle of Willis? This is a common question in Viva. A short note we ask you is for the 5 marks. But when I ask you, what is circle of Willis? So, the posterior communicating arteries are part of circle of Willis, which is located in the base of the brain, which encircles the optic chiasma, which you notice it over here, the hypothalamus embedded, and the midbrain. While the rest of the cerebral arteries supplies by 2 systems. So students, keep this in mind. Circle of Willis is nothing but the communication of cerebral arteries, which are the anterior and the posterior. And mainly the posterior communicating arteries forms the part of circle of Willis by connecting with each other and completes the circle. Now, what are the 2 systems? One is carotid system and the second is vertebro-basilar system. Now, what is circle of Willis? The other synonym for circle of Willis is also circulus arteriosus. Please mention this in bracket. Now, this was named after Thomas Willis in the year 1621 to 1675, which he stayed, an English physician who coined this word. Now, let us see how this circle of Willis is formed. So, it is formed by 2 anterior cerebral arteries, 2 internal cerebral arteries, 2 posterior cerebral arteries, and 1 anterior communicating artery. It gives numerous small vessels to penetrate the surface of brain. They will be called as perforating arteries. They are divided into anterior perforating arteries and posterior perforating arteries. Now, the anterior perforating artery is formed by the anterior cerebral artery, anterior communicating artery, and the middle cerebral artery, which enters the brain through anterior perforated substance, which is irregularly quadrangular area in front of the optic tract and behind the olfactory trigone. And it supplies mainly the large part of basal ganglia, optic chiasma, internal capsule, and hypothalamus. Now, what forms the anterior cerebral artery supply? So, it supplies mainly the orbital part and the medial surface of frontal and a part of parietal area. Middle cerebral artery supplies the entire superolateral surface. Superolateral surface, which has somatosensory cortex, motor cortex, Broca's area linked to speech and production, Heschel's gyrus, and Wernicke's area. The posterior cerebral arteries have the anterior and the inferior temporal lobes, supplies the uncus, which is located at the medial surface of the parahippocampal gyrus, part of the olfactory cortex, and process information from the sense of smell. The inferior temporal gyri and the inferior middle occipital lobe. So in the figure, you can see this carefully. Distribution of cerebral arteries. So here in the larger picture, you can see the distribution, and mainly the anterior cerebral artery supplies this area, the frontal and the part of parietal. The posterior cerebral artery supplies the posterior part, and the remaining portion largely is supplied by the middle cerebral arteries. So what is basilar artery? A basilar artery is formed by uniting the two vertebral arteries, and it branches the anterior inferior cerebellar artery, pontine branches, and the superior cerebellar artery. Now let us see the applied anatomy. What happens when there is this arterial disorder? So the common terms and terminologies used. Stroke. What is stroke? It is a sudden occlusion and hemorrhage. Secondly, aneurysm. Aneurysm is a localized blood-filled balloon which bulges in the wall of blood vessel. So you can see this balloon. Angioma is benign tumors derived from cells of the vascular or lymphatic vessels derived from the cells of the tissues surrounding these vessels. You can see the pia mater, arachnoid mater, and the dura mater in the diagram, and the blood vessel which has been occluded and torn, and now the hemorrhage is oozing from it to form the subarachnoid hemorrhage. So occlusion of anterior cerebral artery will manifest what? So we learn this. So basically, as it is the anterior part, the motor functions, and the prefrontal lobe has the functions of cognitive thinking, judgment, motor initiation, and self-monitoring. Of middle cranial artery, it manifests contralateral weakness of face, arm, and hand. Contralateral sensory loss of the same. Aphasia, a larger distribution, Broca's production, and Wernicke's comprehension. What will the posterior cerebral artery do? So it manifests visual disturbances and memory impairments in the form of hemianopia, and bilateral lesions will cause cortical blindness, which is called as Anton's syndrome. Memory impairment is the temporary low function. Lastly, you must remember the congenital cerebral aneurysm, which occurs in the congenital form. And here, where occurs are the sites of the two arteries which join formation of circle of Willis. It is mainly the tunica media, the elastic tissue, which is deficient. The aneurysm is berry shaped, so it is termed as berry aneurysm. The subarachnoid hemorrhage is commonly, not exclusively, result of the rupture of congenital berry aneurysm as such, because head injuries can also form subarachnoid hemorrhage, but these are in the interpeduncular systems and produces severe pain in head followed by mental confusion that may occur before or later afterwards. So students, how are we doing with this lecture? I hope the crux of Willis, circle of Willis is understood to you. And I post the question for you, and you can post the correct option on WhatsApp group so that I know that this lecture of mine was useful to you and you have understood the basics of circle of Willis. So I ask you this question: which statement of the following is not wrong? Anterior cerebral artery supply Broca's and Wernicke's area. Secondly, occlusion of middle cerebral artery causes difficulty in prefrontal lobe function. Middle cerebral arteries are part of circle of Willis. Aneurysm is benign tumors derived from cells of the vascular and lymphatic vessel walls. Or The posterior cerebral arteries supply anterior and inferior temporal lobes. Students, I am sure you are going to post this answer correctly. I end this lecture by thanking you, Principal Sir, to give me this opportunity to upload in YouTube and to see that the students learn from this small presentation of mine. Thank you so much. Thank you, Bharati Vidhyapeeth. Namaste.